Hello, I'm Dr. Jean Coury. I'm the R. Renda Rollins Chair in Oncology and the Director of the Division of Hematology at the Winship Cancer Institute of Emory University. We are excited to be part of the ACCC's Improving Quality Care in Small Population Cancer project. As a designated community resource center, Winship will be your resource for information, support, and treatment of acute promyelocytic leukemia, chronic myeloid leukemia, and multiple myeloma. Every year, approximately 2,000 patients with hematological disorders and malignancies are referred to us here at the Winship Cancer Institute. What drives us is to provide the best patient care and advance the field.
Big breath in.
The uniqueness about the physician at the Winship Cancer Institute is, one, their expertise in the field. So they focus in one area, and that's their area of expertise. So they are renowned worldwide for the work they are doing. Being a National Cancer Institute designated cancer center is a unique feature for cancer centers because you go through the scrutiny and the very detailed review of your research activity as well as clinical activity. And being a National Cancer Institute designated cancer center would offer you the opportunity to take these drugs that are discovered in the laboratory and test them in patients for the first time through clinical trials in this very well-established infrastructure. Our multi-team approach makes it that the physician manages the patient from diagnosis to cure or to the end of treatment, regardless of what the treatment modality is. So we treat patients both with chemotherapy and when indicated with a bone marrow transplant. And we are not only specialized into one treatment modality, but we are specialized into the whole disease spectrum and the disease treatment. Our approach is what we call a multi-team approach. So basically we use each person's expertise to design an individualized plan of care.
AML with normal chromosomes.
So on a weekly basis, the whole hematology team meets at a noon conference. We review all the new patients referred to us and discuss what treatment plan was designed for these patients and give feedback.
Hi, I'm Stacy Holloway. I'm the nurse navigator in the Hematology New Patient Referral Department at Winship Cancer Institute of Emory University. So when a patient calls the Emory Hematology Department, they will immediately be directed to one person, which is me, the nurse navigator, who will immediately review their records, make sure that their first visit is comprehensive as possible. If they've had any outside pathology or biopsies, we'll bring those specimens here for our pathologist to review prior to their visit with the physician. If they're eligible for a clinical trial, the clinical trial team here at Emory will be made aware that they're eligible and are prepared to provide information to the patient. If they're coming for treatment, the pharmacist is notified ahead of time so that orders can be prepared and the pre-approval process can be started with their insurance, so there's no delay in treatment. So when a patient transitions into treatment at Winship in the hematology department, it's very important for the patient and their family members to know that they do have an advocate, and that person is going to be the nurse on the team. She works closely with the patient's physician and the mid-level practitioner. If the patient calls and has questions about side effects or their treatment plan, the nurse is always going to be the one to respond to their call and guide them through their treatment.
Not today.
Sir, how are you?
I'm good.
Good.
Something that impresses me very much about our program here at Winship in the hematology department is that the physicians and the practitioners really become personally involved with our patients and their family members as they go through their treatment. This is a very difficult time for the patients. Their lives have been dramatically changed, and it's very important that they have a physician and team that they know cares for them and is very personally involved with their treatment.
We have recently published a paper describing the benefit of a multi-team approach in chronic myeloid leukemia specifically. We have shown that the fact that the patient deals with the same team on a regular basis, that have expertise in that field, that manage only this condition, helped with their compliance and with the best outcomes and taking the maximum benefit of the treatment that is currently available. We have integrated the referring physician as part of this team, which helps this physician who manages many other cancers to also develop a sort of expertise by being part of that team. Wherever you practice, you will be facing this small population cancer patients. And here at the Winship Cancer Institute, we're very happy to help you design the best treatment plan for these patients.